participants who could not make it today, that would be great. So we're going to briefly walk through a couple of things for you. We'll give you an overview of our program, and then Kendall and Mary and another an alum of ours, Mark Rosen, will be doing a panel. I'll be asking them a series of questions, and then you'll also have an opportunity to ask them questions. We found this panel to be incredibly successful over the years, and students like yourselves have really enjoyed the opportunity to hear from current and former students. Then Amy will talk a little bit about networking opportunities and sort of how to make the most of your experience at UIC. Kendall and Mary and Mark will talk about that as well. And then she'll close out with some questions that people may have relative to admissions and registration if you've already accepted and things like that, and take any other questions. And as we go along, at the end of each session, we have an opportunity for questions. So feel free to put your questions in the chat box or hold them till the question slides, and we can certainly take them at that point. Okay, what I want to talk about today are a couple of things. I want to tell you about our curriculum. You probably have read about it on the website and the materials that have been sent to you by Sherry and her team, but I'll go through it a little bit further and tell you how we sort of have framed our curriculum and why. I'll share with you more information about some of our concentration certificate programs. I believe Sherry sent out an email this morning. She'll also post in the chat box links to 2 URLs for some flyers about our program and about the certificate programs. I'll share with you a little bit about our applied practice experience that all School of Public Health students enroll in the Masters of Public Health program, and some examples of current employers. I'll talk about our culminating experience, the integrated learning experience, and then our interprofessional education opportunities as well. And then Amy, as I said, will wrap up with some stuff on networking. So the curriculum that we've designed for the Health Policy and Management program, Masters of Public Health, is really oriented towards students who want to go into careers in policy, whether it's an advocacy organization, a governmental organization at the federal, state, or local level, or they are working in other settings such as in the medical practice, and they want to learn more about policy because their work is so intimately affected on a daily basis by laws and regulations at the federal, state, and local levels, and really want to understand things better. So our curriculum is divided into really 3 components. The first is the school-wide integrated core program, which you may have heard about in the introductory videos. That includes 3 courses: Determinants of Population Health, our analytic and research methods. For those of you who have applied to other institutions, that is basically our epidemiology and biostatistics combined into one 6-credit course. And then Public Health Systems Policy and Management. These are like 3 foundational overview courses that every student in the School of Public Health takes. Now, some of you might be considering matriculation into our online program because you're in our professional enhancement program. If that is you, then that analytic and research methods course is taken in 2 separate semesters online, 3 credits in the fall, 3 credits in the spring. The core of your curriculum, though, is our health policy administration courses, and these are tailored specifically towards our MPH students. And so we start out with foundational introduction of public health policy. One of my colleagues who's worked with me for years, Betsy Porter, who's an attorney, and her law degree is in health law. She teaches that course. We've really revamped that course over the years to really have a federal focus and the role of federal policymaking in public health, although we go into state and local and global policy as well. We also have a foundational course in the U.S. healthcare system, Medicare, Medicaid, EMTALA, Affordable Care Act, things like that. We then have a course as well in public health law and ethics. And you can imagine this semester that is a very timely course, and they're dealing with all sorts of timely issues right now related to COVID. Prior to COVID, we were talking about issues related to opioids and other current health law and ethics issues. All students take Intro to Health Economics. To really be involved in the policy sphere, you really need to understand the economic implications of what you're doing. And so it's a foundational course that all of our students take. Public Health Policy and Practice is actually a long version name for our advocacy course. We'll actually be changing that title to an advocacy title, but just FYI, that's an advocacy course. Students last semester actually had or this semester actually before COVID, had an opportunity to travel down to Springfield with the instructor and with the dean and did a school of public health advocacy day. It was a really great experience for them. You'll take a course, this more of a management course in strategic planning and budgeting, which anyone in any sort of healthcare organization needs to understand. And then in your fall semester, if you're in the full-time program, fall semester of your second year, you'll take my advanced health policy analysis course. And then you'll also take sort of an intro research design course, which is really more oriented towards qualitative methods, because the analytic and research methods from the school is much more quantitative. So in our research design course, we focus heavily on qualitative. So when you go to work on your integrated learning experience, you'll have more of an opportunity to do more quantitative or qualitative depending on what you want to do. Depending on which program you matriculate into, whether it's our professional enhancement program, our full-time in-person program, or a joint degree program, determines how many elective credits you'll take, and Sherry and Amy can talk more about that. But generally it would range from either one course, which is 3 credits, up to 3 courses, which is 9 credits. You're welcome to take additional courses, but that's generally the gist of it. In addition to these required courses, you'll do your applied practice experience, your integrative learning experience, and the interprofessional education, which I'll talk about those all in a minute. And I should note that the electives can be taken not just within our program, they can also be taken throughout the school and throughout the campus. So one of the things I really want to hone in on are the skills that you will be gaining if you decide to matriculate into our program. As I mentioned, our foundation is really built around helping you to understand the policymaking process. Just so you know, before I came to UIC in 2007, I spent 17 years in Washington, D.C. I worked as a policy analyst in the federal government. I worked in federal government contracting, supporting all the health and human services agencies, and all of my research is very much focused on informing decision-making at the federal level. And so my work has been cited in federal regulations and things like that. So from my perspective, it's very important that you have foundational knowledge of how the policymaking process works, and we try and ingrain that in you throughout the program. And then focusing on critical thinking would be some of the skills that you might gain in terms of concepts as well. As I mentioned, governing the healthcare system, the economic underpinnings of policy and management, social determinants of health. One of the flyers that Sherry will share with you talks about some of our certificate programs, and we have a health disparities research certificate, which is quite unique to our program. It's entirely an online certificate. So regardless of whether you are an in-person or a professional enhancement online student, that certificate program is open to you. A lot of our students like to take electives in health disparities. The certificate only requires, I think, 3 or 4 classes. So it's pretty easy to tackle that through your elective courses. The theoretical underpinnings of public health will come from the school-wide integrated core courses. I already spoke about law and ethics, the role of stakeholders and their importance in advocacy and policymaking, and then the importance of evidence-based decision-making. We live in a world right now where policies are often made on the fly, and through our program, you'll learn a lot about sort of the value of using evidence to guide decision-making. Sometimes we're in a situation like we are now with COVID where it's hard to do that, but other times there is a window of opportunity to introduce evidence into the policy process, and you'll learn about that. Some of the skills you'll gain in addition to critical thinking: strategic planning and budgeting, doing in-depth literature reviews, how to communicate with decision makers, both orally and in writing, learning about policy advocacy, learning about legal epidemiology and policy surveillance, which are tools for those of you interested in doing like legislative and 50 state evaluations of what states are doing across the country in terms of law and policy. policy development, analysis and evaluation, and then, as I mentioned, qualitative and quantitative research skills. As I've already alluded, we have some certificate programs. We also have several concentrations that are open to all students. There's a global health concentration, gender and women's studies, survey research methods, and violence studies. And then we have 2 certificates. So with the certificates, you'll actually get an additional certificate in addition to your MPH. We have one in health disparities, and then one of our participants on the call today, I believe, is already participating in or finishing up the GIS certificate program. The Applied Practice Experience is a 3 to 5 credit, typically, program that all students do. And it's really giving you an opportunity outside of the curriculum to gain real-world public health experience. And so we've listed here some examples of where students are currently doing Applied Practice Experience and or graduates of our program and where they are employed. But locally, students may work for the American Medical Association, which is based here in Chicago, Advocate Healthcare, Heartland Alliance, Chicago Public Schools, the Illinois Public Health Institute, the American Lung Association, based out of here, and the American Heart Association, Cook County Department of Public Health, Illinois Department of Public Health. We have students all over the place. And in fact, with COVID, a lot of our students are actually helping to man the hotlines for the Illinois Department of Public Health currently under this COVID crisis. So we're at the forefront of what's going on here in Chicago and in the state. I wanted to share with you some examples of some titles of projects that our second year students are doing for their culminating integrative learning experience. So we have a student doing a study right now on the regulatory effects on rates of opioid overdoses. Another student developing a strategic plan for the Illinois Hunger Coalition. We have a student doing 50 state policy surveillance on STDs and STI prevention and recommendations for the federal level. We have another student looking at food safety implementation amongst food establishments across the campus. We have somebody doing a global study focusing on practical and financial aspects of providing healthcare for low-income rural populations in Uganda. Using GIS as a tool to optimize city community health resources. We have other students doing policy analysis on prescription drugs. A student doing a research project on breastfeeding equity and helping to inform stakeholders across the state on disparities in that area. And then we have a student doing a project in Chicago Public Schools looking at policy options for CPS to expand its LGBTQ sex education program. And those are just a few examples. Kendall's working on a project right now that's a policy surveillance project. So I haven't listed them all. These are just sample titles. And then our interprofessional education program, this is an opportunity to work and engage with professionals throughout the campus outside of public health. It's required of all Master of Public Health students per our accrediting body. And students required to be enrolled in this course. It's a non-credit course, basically. Ideally, you'll do it in spring of your first year. And it really focuses on an opportunity to work with professions outside the discipline of public health. So social work, medicine, allied health sciences, nursing, you name it, business, to really tackle problem. I imagine this year's IPE day will be virtual, and I imagine it's focusing on COVID, but really focusing on timely topics. Last year it was on opioids, one year it was on HIV. It just varies from year to year what the topic is, but it's a one-day session and it's very easy to accomplish. We also anticipate that most students will do it through this one-day session, but we have other options available for our online students to engage in interprofessional education outside of the one-day in-person session. So I'm going to stop right now and see if there are any questions at this time before we turn it over to our panel, assuming Mark has joined us.
I have a question.
Sure.
It's kind of open, up in the air. So if there are any changes to the fall 2020 semester because of COVID, when will we be notified about that?
So we're going to get to that probably at the end of the session about sort of the decisions. This is not a school-wide decision, actually. It's a university-wide and a system-wide decision. Right now, we have no information other than we're planning to operate as normal come the fall. And I don't know, Sherry or Amy, if you have anything else to add to that at this point in time, but I guarantee you, as soon as we know, you will know. All we know right now is to assume that we are operating under normal conditions for the fall.
Yes, that's correct.
Any questions about what I just presented? We have plenty of time for broader questions at the end of the panel session for sure. But any questions about the curriculum, requirements for the program, skills? Okay. Has Mark joined us, Sherry?
No, I don't see that he has yet, Jamie.
Okay.
But I also wanted to remind everybody to submit any questions in the chat box, and we will again address those at the end of the session.
Great. So I think we're going to go ahead, though, just in the interest of time. Are there any other questions, Sherry, that have come in thus far before we start the panel with Kendall and Mary?
No, no questions yet.
Okay. I think I'm going to go ahead and stop sharing my screen for the moment so that we can just focus on the panel. And I'll go back to that when we're done. So I want to thank Kendall and Mary for joining us today. We really appreciate your taking the time. Sorry, I just wanted to grab my questions here. So Kendall and Mary, Mary, do you have a video available for you? Oh, there you are. Hi. And then if you just want to unmute yourself, Mary, that would be great.
Absolutely. How are you?
Okay, good. Great. Thank you. So I thought we could just start out. I know you briefly introduced yourselves already, so thank you again for joining us today. Just to remind everyone, Kendall is she's really a third year, but she's a second year MPH student, and she's a joint degree student with the School of Social Work and MSW program. And then Mary is a first year student in our MPH program. So why don't we just start out with a broad question to you both about sort of your decision to come to UIC and join the program. You know, we're not a one-size-fits-all program. So can you tell everybody on the call today a little bit about your background prior to matriculating the MPH program? And then I'll follow up with a second question. So Kendall, why don't you go ahead and start?
Sure. So in undergrad, I came into college with an undeclared major, but my interest was really in pursuing research. I graduated with a degree in psychology, and throughout that time, I also minored in history. I think I was one class away from doing a double major. And throughout my time in undergrad, I worked in various labs, volunteered at Larry's Children's Hospital within their psych department. And later, I also became a paraprofessional at the former UIC Crisis Hotline Center. So there was this continued work towards focusing on anxiety disorder, suicide, and then also just, I think with history, really understanding it from a macro lens, and also just how history and culture influence where people are today and the mental health issues that they may be experiencing. So I then kind of knew I was going to go to graduate school. It was just a matter of what type of program, given the background I had. I chose to pursue a master's in public health and social work so I could continue to pursue my interest in mental health, which I can do with my master's in social work a bit more clinically. But then with public health, I'm able to incorporate more the principles I've learned, I think, along the way, and then really get a better understanding of how policy relates to mental health treatment, which is something that's really important for me. I primarily focus in pediatric populations and young adults. So with them especially, there's a lot going into policy.
Great. Thanks, Kendall. We'll ask you more about the joint degree in a little
Yeah.
bit. Mary, tell us a little bit about your background prior to matriculating in the program here, because it was not in policy.
Absolutely, yeah. So I studied exercise physiology in my undergrad. I had the opportunity to participate in a good amount of research in my undergrad and in the following gap year after. Throughout my undergrad, I kind of was exposed to the issues of equity and access to care and all of those different barriers to care. So I decided that clinical medicine wasn't really where I wanted to end up. I was originally thinking about physical therapy. And I decided to kind of explore policy a little bit further by pursuing this program. I was really attracted to UIC because of the focus on the federal level policy. And in my gap year, I worked as a neuromuscular physiology research assistant at a lab at Marquette University. And it was really interesting to be able to work with the aging population. It's a massive issue in public health, and that kind of informed my progress moving forward.
Great. Well, thanks, Mary. And I actually have a follow-up question for you. I know when you were at this time last year and you attended our preview day, you were deciding between Michigan and UIC.
Yes.
Why did you end up choosing UIC over Michigan?
Absolutely. So I was admitted to both kind of later in the game. It was a tight deadline to make the decision. I'm originally from the Chicagoland area, and I think that the tipping point was that Chicago in and of itself is a case study for public health. It's such a concentrated, interesting, diverse region with a ton of amazing public health institutions and research and incredible hospitals, as well as a lot of different government stakeholders. So I felt like it was kind of like a hotbed for information, in addition to having family and friends and other contributing factors. But I would say that Chicago in and of itself as a case study for public health was really what tipped my scales.
Great. Thanks. And Kendall, I have a question for you, and it looks like Maggie had the same question. So can you talk a little bit about what's involved in doing a joint degree? How much longer does it take? Is it more work each semester? And then we have a follow-up question also from Maggie about it.
Yes. So the program is 3 years. I started off first in the MSW program, but there are a lot of people who start off doing their MPH their first year. Your first and second year are almost exclusively just social work classes or just public health, depending on what program you are in at that moment. And I know that that applies to like the MBA joint program as well. And then my third year is really just a mixture of social work and public health courses. And when I say public health, that last year is really just those HPA concentration courses. I think in the first 2 years, it really wasn't any extra work. A lot of it is just more logistical. So making sure that you have all of your credits balanced and that you're actually really getting what you want out of the program in the end. And then with this final year, it ended up being a little bit more work, but it's my own fault. I chose to be at an internship that I'm really grateful that I was able to get. I was at the Lurie Children's Hospital in their inpatient psych unit, and I chose that specifically because with the joint program, it's really hard to be able to fit in non-core classes. So that's something that I would say if you want to take any of them, think about that your first year, the first semester of your second year, just so that you can make sure you can fit it in and stay within that 3-year mark if that's something that's important to you. So I think in the end, it ended up being a little bit more work, but that was also because it was really important for me to be able to get as much as I could throughout my internship. And I know there was a question about how can I use my MSW skills in more of a clinical capacity. So if you are a social worker, you can go on a mental health track, and at UIC in particular, there's also a medical social work track that I know a lot of the joint students happen to be on who are an MPH. And following graduation, you become a licensed social worker, which means you can work clinically, meaning focusing on mental health or whatever you choose to do with medical social work, if that's what you want to do. And then after it's about hours, so maybe 2 years or maybe 3,000 hours, and then it's about 2 years of working under a supervisor, you can then potentially practice privately. Meaning if you wanted to just be a clinician, but then also incorporate that public health focus in your work, for people I know that have the dual degree who are further along in their careers, many of them tend to work at larger hospitals such as Lurie's or Northwestern, where they are seeing patients on one side, and then on the other end, they do a lot of community-focused research or policy-oriented research.
Great, thank you. Mary, so can you talk a little bit, since you just completed the first semester and you're now in your second semester, are all the first semester classes integrated core classes only?
No, they are not. That was another attractive component of the program, was that in the first year we were exposed to policy classes right off the bat with Betsy Porter's Intro to Health Policy course. It really kind of complemented our core courses and gave us kind of that little taste to the awesome policy classes that I'll get to continue to take this semester and next year.
And so can you tell them what classes you're taking this semester?
Yes, so right now I'm enrolled in one core course, which is the management and
Public health management
public
systems.
health management and systems. And then in addition to that, I'm taking, oh my goodness, all the titles of these classes, Advocacy Tools, which is the new title for that class. I'm also taking Introduction to U.S. Healthcare. What else? The 432, 420, sorry, I'm just trying to remember all the titles of them. And the, economics.
Yep.
Yes, that big behemoth of a class is really great. Intro to economics as well.
Great. So there was a question about how you choose and schedule classes. So if you're a full-time student, we pretty much map out your schedule for you, and Amy will talk about that a little bit further later in the session. So my next question, has Mark joined us, Sherry?
He certainly is. He's
Okay.
water.
Hi, Mark. Can we see you?
Yeah, he should be visible right here. Do you see him?
I don't see him, but as long as
Wave, Mark.
Yeah, on my screen I'm not seeing, but that's okay. As long as everybody else sees Mark. Mark, can you speak? I don't think we have his audio yet, so I'm going to go on until maybe Mike. Mike, maybe you can correspond.
Mike's not in any longer, but here, let me do this. Okay. There you go, Mark. Mark.
Hi, can you hear me?
Yeah, we can hear you. Hi, Mark. Thank you.
There we go.
How are you?
Amy.
Yay.
Doing well.
Good. Thanks for joining us. We sort of got started, so I just want to give you first a chance to introduce yourself, and then we're going to jump you right into some questions.
Yeah, sorry I'm late, everybody.
No worries.
Was coming from one meeting to another. So my name is Mark Rosen. I graduated, SPH graduate from the Health Policy and Administration track, I think in 2012. Currently work at YMCA of the USA, which is the National Resource Office for YMCAs around the country. It's based in Chicago. And I serve as our Director of Healthcare Integration.
Great, thank you. So let me just backtrack a little bit. Mark, you did a study abroad, I think in between first and second year for your applied practice experience, or your, I forget, field experience, I think it was called at the time, field practicum. Can you talk a little bit about that and how that program worked for you?
Sure. So I did, it was part of the field practicum at the time. So is for my capstone project essentially. And, I was working full time and doing school full time throughout my program. And so I wanted to do, at the time was working in lung health, asthma control, tobacco control in community-based, at a community-based organization in Chicago. So I wanted to do something that was going to be sort of, have this synergy between what I was doing professionally as well as, of course, the curriculum was based on. And so I had previously lived in Argentina. I studied abroad there in college, and then I moved back down there after I graduated, lived down there for a year. And so I thought to myself, well, I know that this isn't on one of the sort of pre-listed options for doing a field practicum, but I'm gonna see if I can make this work, because why not? And so I sort of, just investigated on my own and took it on myself, and found some contacts down there at the Ministry of Health around tobacco control, brought the idea to, Amy and team at, UIC. They were really flexible about it and said, yeah, as long as you're able to have it integrate into what you're trying to accomplish in the program. And so I was able to go down there for a couple months and work with the Ministry of Health and do essentially help develop a survey and assess through qualitative and quantitative interviews, assessments, pediatric environmental tobacco control environmental exposure to tobacco with pediatric providers down there. So I had a chance to go down to some public hospitals down there, interview some pediatricians, do some phone interviews. It was cool. So I really enjoyed it.
And now we have the global health concentration, so people who are interested in doing things like that can do it in a more formalized and structured way. So thanks, Mark. So Mary, and Kendall, what's a typical day like for an MPH student? Are most students working full-time while completing classes? Is the schedule flexible enough to allow that? And I should say that we have both full-time and part-time programs. So we can, students can work with Amy and with Joyce, Ilama, Roselia, Veramontes if they're online to map out a schedule that works best for them. But in a typical day, Mary and Kendall, what's your day like? Is the schedule flexible enough to allow you to work as well as be in school?
Yeah. So the year that I was only taking my public health classes, which would be the typical first year, I think, for any HPA student. I was able to work. I still actually work. I serve as a graduate assistant at the Black Lung Center of Excellence. It was just kind of a position that I saw that sounded interesting. I knew nothing about coal miners and things like that, and I thought it would just really expand my horizons in terms of, I'm local to Chicago, so it's like a whole nother world for me. So I thought it'd just be beneficial for me to do. So I say a typical day for an MPH student. Most of my days, I think I had class almost every day. Or maybe 4 days out of the week. And I would either then go to my office before or after that. And I think that was pretty common for most students. I think at least all of the people I interacted with worked in some capacity, either in a lab or a doctor's office. Really just trying to make sure that they were getting positions that either were, again, expanding their skills that they already had, or were teaching them new ones. So I think it's completely feasible to work.
And Mary?
Yeah, I would agree with that in terms of scheduling. I know there's a lot of diverse situations. Everyone's involved in different things. Me personally, last semester, I had the opportunity to come on as a research assistant in the Policy, Practice, and Prevention Research Center, working with Dr. Shriki and a few other groups on a project with CPS. So I'm currently working about 25 hours a week. Fortunately, it's super convenient commute just up a couple floors in the SPH building. I'm taking classes, fortunately this semester, only Tuesday and Wednesday for about 8 hours a day. And then I work on the Monday, Wednesday, Friday, or Monday, Thursday, Friday, excuse me. But last semester I had more of a widespread of my classes were generally, I think it was 4 of the 5 days of the week in the morning. And I was nannying and doing some research as well. So it's kind of, everyone finds their own way about it. Navigating it is obviously, it requires a lot of time management skills, but for the most part, I know that everyone's had flexible schedules and they can work with the advisors to find the best fit for them with online classes as well as in person.
Great, thank you. And then Kendall or Mark, did you RA for anyone? I know Kendall, you mentioned you're in a GA position. How did you go about finding that position?
Yes.
And Mary, same question.
Mm-hmm.
So with my position, to be quite honest, I was just applying to you get emails over the summer about positions, and I was just applying to any of the ones I thought looked interesting. I do know other ways that other people have gone about it, though, is that least like more so with my social work side, is that a lot of people would email professors or people they knew were doing research that they were interested in directly. And that seems to be how a lot of people ended up getting positions. I was just fortunate enough that there was an actual position already clearly visible that ended up being a good fit.
And Mary?
I would agree. I had the opportunity to meet with Dr. Shriki on my preview day and talk about my interests and experiences, and school health happened to be one of our kind of overlap. So coordinating and reaching out and really exposing yourself to the staff and faculty at the university. There's a ton of amazing research going on, and you can kind of make anything happen if you push and present yourself as a resource to them. I know I have a lot of co-classmates who are also doing kind of what Kendall did and just applying to everything that comes across the listservs and email chains from the university about opportunities. Everything seems interesting at the beginning of your public health practice, and everything is not feasible, but exposing yourself to different opportunities and being open and always having a resume ready and happy to write a cover letter for someone is kind of the best way to go about it.
Yep, for sure. Mark, talking about professional experience. So talk a little bit about how your degree, Mark was at the Lung Association when he was at UIC, and then he moved from the Lung Association on. So do you want to talk a little bit about your career trajectory and how your Master's of Public Health degree has helped you navigate so successfully in the nonprofit and advocacy worlds?
Sure. So I was working at the Respiratory Health Association when I entered the SPH program at UIC, and at the time was doing smoking cessation and asthma education in Cook County Health and Hospital in their outpatient and inpatient settings with patients one-on-one. And, really felt like in my day-to-day professional experience, I was getting this community health sciences perspective because I was on the ground in implementation. And I wanted to complement that with more of a policy experience. And so that's why I went the H8 Health Policy Administration route. I think that, the way the degree, I always say when people ask me, like, what did you get out of the degree? I'm like, what I put into it. And that's the best advice that I could give to anybody. You're going to get out of it what you put into it. And I took it pretty seriously. I mean, I did all, can't say this for undergrad, but I did all of the readings in graduate school because I cared about it, right? Yeah. I cared about it. I was interested in it, and it so enriched the experience that I had and what sort of the skills that I was able to come out with. In addition to the network that UIC SPH offers, I think is invaluable. So throughout sort of navigating my career, I stayed at the Respiratory Health Association. I was doing the sort of at Cook County Health, doing that work for a year, and then I transitioned to manage our community interventions at Respiratory Health. And then I've been at YMCA of the USA for the past 7 years. But throughout navigating all of that, I can't tell you how many times I sort of come back to finding somebody who is a fellow alum of, the SPH at UIC, and just how beneficial that is. And even in going to job interviews, saying that I, was a UIC SPH alum, that carries weight. It is a highly respected school of public health around the country. And so I would just say that for me, that's some of the aspects that I've taken away.
Great, thank you. Kendall, so can you talk a little bit about PHSA, the Public Health Students Association?
Yeah, so I am the vice president of PHSA, and we are really acting more as a governing body for SPH. And then we represent the student body in meetings with various administration offices, such as the dean. So whenever there's maybe issues going on with the student base, or really just concerns, questions, things that we want, we tend to be the body that is then relaying that over to the administration and making sure that, the students are getting what they want in the end. And then I became involved with this because I was looking for leadership opportunities, and I also wanted to provide a greater platform for joint degree students. So for those of you that, if you do go into our program, you'll see that we now have a joint degree liaison who's managing all of the joint students between the different schools with SPH, which is nice.
Thanks, Kendall. And then can you also talk a little bit about how students can get involved in all the committees throughout the school?
Yeah. Yeah, there are a ton of committees that you guys can be involved with. And I would really say if any of them seem interesting to you, the time commitment is pretty low, to be quite honest, depending on which one you're in. And they're really great learning opportunities. I think, Mary, you might be in the one that I think if you are in this one, is it you? But there's one where I know some students get to speak on the this governing body where you're working with all of the with administration from all of the different health colleges.
It's the
And that
graduate
has-
student organization.
There you go. Yeah.
Yeah.
Are you in that one?
I've been on like an email chain. Yeah.
Okay. Okay, that might be why. But
Still too early to tell.
yeah, there's a lot of different committees within the colleges. And what's really nice about it is that you're really able to, on one end, give other people an understanding of what public health really is. And then on the other side of it, make sure that it's like respected and things like that, because I think now social work actually just got into that. And I think a lot of people have different impressions of what social work actually looks like. I think it's common to think it's more so case management versus the clinical work and medical work that we do. And the same goes for public health, where you meet a lot of people in the medical field who don't necessarily understand what it is. So that's one of the really great committees that we have. I think right now elections are going up, and in the beginning of the semester, you should also be getting emails about elections coming up again. So I'd say, it doesn't hurt just to apply. It's not really a blow to your confidence if you don't win, because it's not like a popularity contest or anything. So that's kind of nice.
So I have chaired since 2017, when it first formed, the Master of Public Health Oversight Committee for the school. And I don't know why, but we consistently have had HPA students representing the school, the student body on that committee. And so I can tell you that we take the students' input extremely seriously. They've been doing sort of an internal assessment of feedback on the integrated core and providing that feedback back to all the MPH program directors like myself. And so student voices are very valued in the school, and other than our appointment, promotion, tenure committee and a few other committees throughout the school, there are student representatives on all the committees. So student voices matter. Mary, do you want to talk a little bit about what the dean's been doing recently with his town halls, and particularly with COVID? How he's been offering these town hall opportunities, and the level of engagement that the dean provides to the student body?
Yes, absolutely. So Dean Giles is a fantastic leader, I think, for our school and in the UIC community as well. He, in response to the COVID, has set up several town halls, actually. I think it's been weekly, maybe bi-weekly, with both staff and faculty, a whole school body, and then student-specific response. These are kind of unprecedented times, and I think a great sign of a good leader is to be able to be accessible and to be transparent with all of us about how we are reacting as public health professionals and how we're reacting as academics and students in these kind of unpredictable and strange times. I had the opportunity to sit in on a student town hall and the staff and faculty town hall. He just fielded questions from everyone, kind of explained how we're trying to activate alumni and students to be a best resource to the community. It was really a fantastic and encouraging.
And he's not just doing that just because of COVID. Like pre-COVID, he had what Kendall is monthly brown bags, right?
Yeah, and his availability to the Public Health Student Association. He'll sit in on the meetings, ask questions. He's very, very available to people.
Yeah, and I'm in agreement with that. I think he's been fairly responsive to us, especially considering, I do agree with what you said, Jamie, that it seems like a lot of HPA students tend to be in a lot of these different committees. And I think it's just because advocacy is one of those fundamental traits that maybe just comes naturally to a lot of people that tend to go into HPA. So I think he's done a pretty good job in, listening to us and really taking into account our perspectives and how we think that maybe improvements can be made or what's being done well.
And one thing I will note, I don't know what was in Wayne's introductory video to you all, but Wayne was at the CDC for 20-something years before coming to UIC. Like, he literally retired from the federal government and came to be the dean at UIC. So he is intimately involved in all things public health and has been for decades. And the school itself is a leader in what's going on in the state right now with COVID. So we are very fortunate to have him. So I know Mary needs to jump off actually for one of my research projects because she's about to go work on a discussion group, which we're still running remotely somehow during COVID. So Mary, thank you for joining us today.
Absolutely.
We really appreciate it. But Mark and Kendall, if you can stay on for a few more minutes, I just have a few more questions for you both.
And I'm happy to send out my email if anyone has questions about the first year experience.
Thanks a lot,
so
Mary.
Much. I'll see you guys later. Bye-bye.
Bye. So, Mark, sort of historically, I know it's been a while, but are there any classes in particular that resonated with you over the years that have sort of helped you with the work that you've done over the course of your career?
Yeah, I mean, I think you know what I'm going to say here. It's your class.
That's not why I asked the question.
I know you didn't, but it's true. And, you know, there's a couple classes. I think Dan Schwartzman's public health ethics class really helped establish a critical sort of, foundation for navigating the sometimes tricky line between different tensions that exist in the public health world. In fact, what we're seeing right now, right? The risks and benefits of a public health approach and the risks that it might have around the economy, right? Those are public health ethical questions. And I think that was one course that I thought was really foundational. Another course which I didn't think that I would use as much was around healthcare or health policy. So Bill Kling's course is really about coming up with a policy action plan. And it's interesting because a lot of what I do right now in my job and have done over the past several years is track healthcare policy at federal and state levels, reading physician fee schedules. The federal government just came out with new rules that are expanding telehealth over the past couple of days to respond to COVID-19. I've been reading those over the past couple of days and figuring out, okay, how does this translate to the clinic to community partnerships that we establish on the ground at YMCAs around the country? So that course is really foundational. And the last one I would mention is the one that, you taught, which was around really, policy assessments and, coming up with sort of, evaluating the policy landscape for a given issue and then being able to come up with a range of alternatives that you might think about, choosing from, and then really being able to, choose an policy alternative and be able to back up your argument for why you choose that. And those skills are just so practical, and I continue using them to this day.
Great, thanks. Kendall, do you have any other courses you want to call out?
Yeah, well, of course, yeah, your class, I loved it.
I did not pay them to say this.
So Dr. Shriki does the health policy analysis course. I think I should preface a lot of it by saying that my understanding of policy, I think coming into the program was quite limited. So just because my background was more clinically focused. So I think that course in particular did a really good job of bridging research and policy together and really helping me understand the just where that interconnectedness is. I also enjoyed, I think it was law and ethics or health policy, like the two Betsy courses. Yeah, law and ethics is a great one. Actually coming out of that, as I was going through that course, I'm starting to consider ethics as a field that I would like to further study and potentially go into down the line. And that was not something I really thought going into it, but there are a lot of ethical questions out there. And I think that class in particular, along with the base 415 course on general policy, gives you a better understanding of just what's going on in the news and what you're looking at, because I think a lot of the times you can be, it's easy to look at it and kind of just be, led to believe things based off of opinion. But what's really nice about these courses is that they allow you to be able, like in research, just go and be like, okay, let me just look at the data. Let me look at this actual report and understand what I'm reading. So I think that's been a really nice part of that. And then with bridging that more into maybe clinical work that people do, then what are the ethical questions that we have coming from this? So that's been pretty fun.
Great. So both of you, Mark and Kendall, neither one of you really came from a policy background. And I don't know, Mark, I might be dating you too far back. So if you're not prepared to answer, that's fine. But Kendall, at least, how can people best prepared to excel in a graduate school program? Like, what are some lessons learned that worked well for you? Both of you managed to work while you were in school. How did you navigate that?
Yeah, since I had a 1-year gap from undergrad, so I think I was still pretty used to being in school. Most of what I did was, I think the biggest thing actually was finding a good planner, especially with balancing work, research opportunities, and volunteering, and then also just your academics. Finding a good planner that helped me really make sense of it. So if anyone has any questions about which ones I think are good, feel free to email me. I'm really into that world. And then the other part of it is really being honest with yourself and making time for self-care. I think a lot of the times with public health, you can read things that maybe are a little bit sad, or it starts to weigh on you for a while after a while. So interacting with my classmates, we do study groups. I'm friends with most of my classmates, I think, from the original cohort that I was in, and making sure that we study together or things like that, so that they can remind you of things that you forgot to do, and keep you on track, which is nice.
And along the lines of the cohort, because we've had a couple of questions about this, the size of the cohort varies whether you're talking about the full-time in-person program, the part-time program, or online program. So our typical in-person full-time cohorts averages around 20 or 30 students. It just varies from year to year. We don't know the size of our cohort yet for this year, particularly because of COVID and our delay in allowing people extended time to confirm their acceptance. So, but our typical full-time cohort is about 20 or 30 students. Our online cohort varies because those tend to be our part-time students. But regardless of whether you're in the in-person or the online cohort, you get to know your cohort very well. The online students tend to take classes together, the 403 class, or 402, 404 and 405, the 403, they'll take some of the online courses, and the online courses are asynchronous. And so our students will tend to say, I'll see in the introductory meetings, oh, hi, it's nice to see you again. I haven't seen you in a class for a while. And likewise, as Kendall mentioned, the in-person cohort, they all take the integrated core courses together. And they all take first semester our Intro to Public Health Policy course. So they get to know each other right off the bat and really do form that relationship and cohort. Mark, I'm going to give you a closing opportunity here to sort of any last words of wisdom you have for these rising public health practitioners. Anything you would like to share, guidance, suggestions you have, that would be great.
Yeah, so I mean, I think, the quality of the UIC public health program speaks for itself, so I won't really talk about that. I go back to where I started, which is I think you get out of it what you put into it. And so, I really think about it's important to maybe in some ways contrast to maybe undergrad. For graduate school, I think it's important to go in with a plan, or at least to develop a plan very early on, to know what you want to try to get out of it, so that as quickly as possible you can start pursuing those ambitions. It may turn out that what you originally set out as interested in, or you originally want to accomplish, you pivot along the way, and that's totally fine. But the fact that you immerse yourself in something is going to be so crucial to getting what you want out of the experience. I wasn't that involved in on-campus activities because I was working full-time and school full-time, but I knew that for me, I wanted to apply as much as possible from what I was learning in school to my job on a daily basis, and that was my laser focus. But I have friends who really wanted to get networked and get involved in different committees through the school, public health, etc., and they got immediately immersed. And whatever path you choose, I just think it's important to have an idea of what that is for you going in, and then start pursuing it rather than waiting. Because if you wait and if you're passive, I think you'll find that the experience will pass you by.
Well, and I just wanted to jump in real quick here. Mark and I were doing our MPHs at the same time, and both of us were part-time. And I can say that I felt like we had a really good cohort experience too, even through group projects and really getting to know each other. And so from my perspective, I feel like even if you're part-time, full-time, online, there's a lot of chances, because I know that that was a question about feeling like, do you know your cohort? Do you know your classmates? All of that kind of stuff.
Thanks, Sherry. And Kendall, any last words of wisdom?
Yeah. I really want to echo what Mark said. This really might be the last period in your life that you're really just dedicated to academics and learning. Once you transition into the workforce, things just look a little bit different. So I would say really take all of the opportunities you have to learn. As in being a student, you get discounts to a lot of different lectures and conferences, and even within the school, there are so many interesting ones. I mean, even we're in HPA, but I know EOHS, the Environmental and Occupational Health Department, they have really interesting lectures about things that you had no idea existed, but that it actually might really impact the client base that you work with. So I've thought that to be the most important part for me, where if I have an hour in my day and I just want to get away from my desk and there's a lecture going on, just going down there and listening, because you don't really know what you're going to get out of it. And I think the other thing that I would say is really advocate for yourself and those around you. This is a really good time that if you are a person that is a bit more passive, learning to have that voice and put the work into it in the beginning, versus letting things kind of pile on for you. So I think that was a big part of it with me being a joint student, and there were some changes in the curriculum at the time. And I see Amy smiling because she knows that we kept knocking on her door about things, but that was really important to us. And that then puts me in a position that when I go into the workforce, or really just any other part of my life, I feel a lot more confident in my ability to establish change for my client base and also just for myself and the people around me.
Great. Well, Mark and Kendall, I can't thank you both enough. I owe you both lunch. Really appreciate it. Mark, hopefully I can get you in there and be a guest lecturer once we get things figured out with COVID. But I wish you both a wonderful weekend and stay safe and healthy. Thanks for joining us today.
Of course, thank you. Bye.
Sounds good. Good luck, everybody.
Rebecca, I have a question. I don't know what you're saying. Everyone's saying bye. Okay.
Thanks. Okay,
Bye.
I'm just gonna share my screen again and turn it over now to Amy, who is gonna walk you through some additional things. So hold on one second. Screen 2. Hold on, sorry. And hold on. Sorry, just a little technical. I'm trying to do too many things. There we go, Amy. All right, are you on?
Yes, hello everyone again. I think there was a pretty clear theme throughout the discussion with our current students and with Mark, our alum, that getting involved really makes a difference, and it really is all about networking. And there are lots of opportunities to do so here. And I think just echoing what they're saying, that it really makes all the difference in the world about the kind of experience you have here at UIC. And quite frankly, even if you don't choose UIC, School of Public Health, I would hope that you take what they said into consideration anywhere. But here at the School of Public Health, we provide so many different opportunities for students to get involved. And I think one way, which also this is something that many applicants and current students ask about, is about working, about getting a research assistantship, a teaching assistantship, or a graduate assistantship. And that is possible throughout campus. It doesn't just have to be at the School of Public Health. There are lots of opportunities available, and I think Kendall and Mary talked about that a little bit. And the students who find those are the ones that are really actively looking for them, and it is possible. Sometimes it can be difficult for the first semester, but once you get in and get involved, and if you're really actively seeking an assistantship, most students do find them. I even suggest to take anything that comes along, because for some reason, as soon as students find one assistantship, it just opens doors to other possibilities, and you get to know other students and other faculty and other staff, and the more you network, the further your time will go and more beneficial it'll be. Kendall talked about PHSA, our student organization, but there are lots of student organizations that are available. I know people are busy, and I think Kendall also mentioned time management, but I think it really enriches the experience you have here. And if you can balance that out, students can work on campus with an assistantship for 25% and receive a tuition waiver as well as a stipend, and it does cover some fees as well. But there are other opportunities. Not all students are looking for jobs, or they may already have a job. And we have events, and at many of our events, we invite alumni, as well as inviting students from other colleges or other departments. That's another way to get involved. Volunteering is an excellent way to get involved. I think, you know, sometimes it's difficult to put too many things on your plate and then spread yourself too thin, but frequently we're asking students, oh, could you volunteer for this one event? Getting involved, networking just opens so many doors for you that may not be open to other people. Advising is another way to really make the best use of your time here. In HPA, there are multiple people that help students with advising. I help students with advising, although frequently when students are coming to me, it's usually because they're bigger issues. We have an academic advisor for each student. For in-class students, that's Joyce Elam, and for online students, that's Rosalia Viramontes. And then there's faculty advisors for each student. It's really important that students meet with their advisors at least once a semester. Most students meet with their advisors a couple of times a semester. We really like to get to know our students and have them check in, and for us to help develop the curriculum that you're interested in. And I mentioned alumni a bit. We have a very active alumni, and they are constantly asking how they can help more with the students. So that's just another way that I think you can build in your networking opportunities. Sherry, did you want to say anything about networking at all? I know we hadn't really planned to, but since you are our communications director.
No, I think you guys covered a lot of it. I mean, networking, again, I can't say it enough. I think if anybody is gaining anything from today, it's this is your career, this is your start. You got to network, you got to get out there, you got to make it what is, you know, what you want it to be. And we're here to help open up those pipelines for you and getting you in front of the right people. I mean, never, ever hesitate to reach out if you have a question or about any of those things. And, you know, Amy and I have been working together for a long time. And we are really, you know, don't worry about asking it to me or Amy. We'll get you in the right space, you know.
Very true.
So, Amy, we have only about 15 minutes left. I want to make sure we have opportunity for additional questions. And so maybe we could move on. I know we had a lot of questions in the chat box during the panel about sort of start dates, also about registration and course selection and how much flexibility students have. So maybe you could talk about some of these things.
Okay. Well, before we move on to registration, I just wanted to quickly talk about ITE, intent to enroll. If you are planning to attend, I'd like to ask that you go into the UIC application portal and submit your ITE. That's the way that we know students are coming, and then we immediately get you on our list of new incoming students so we can start reaching out to you about things that'll be going on over the summer and get you ready for the fall. If when you apply, you were still in a program, whether it was an undergraduate program or a graduate program, we will at some point need you to send your final transcript with degree conferred to the UIC admissions office. So there's just, that's nothing we have to deal with right now, but I just wanted to mention it. Once you submit your IETE and we have you on our list, we will be sending out welcome packets this summer, probably in the beginning, either the end of May or the beginning of June. Your welcome packet will have all sorts of information about getting you started. And then soon thereafter, you will set up a meeting with your academic advisor and work out what we call your advising document. And your advising document is a tool you will use the entire time you're a student. It'll lay out all your courses and it'll just give you an idea of what you're going to do semester to semester. It is not written in stone. Students change them all the time. Our first year full-time students will all be registering for 2 core courses and then our HPA core Introduction to Policy course. And we can get you registered for courses soon thereafter you meet with your academic advisor.
So I've been keeping a running total of all the questions from the chat box, and just through that and piggyback on that, Amy, is for the first semester classes, there was a question about the integrated core courses, and if that was first semester classes only integrated core courses. Do you want to speak about how the integrated core works?
Yeah, so there's 3 integrated core courses, and it really depends on whether you're full-time or part-time. Full-time students will take the first 2 courses in their first semester along with our core course, and then they will take the last core course in their second semester. For part-time students, we can work that out depending on how many classes students are taking. Our part-time students can take anywhere from 1 course to 3 courses to be considered part-time. So it really does depend on the student and their workload and whatever else they're balancing. We will work with students to put together a schedule that works for them. We also, sometimes I get asked the question, if I'm full-time, can I switch to part-time and vice versa? And yes, we're here to work with you. We have students that are completely online. We have students that are completely in class. We also have students that are in our hybrid program, which is online and in class. So we're very flexible.
Okay, and to that question, there was a question very, very early on about the ability to completing an MPH within 1 year. Could you speak to that?
So Amy,
Yeah.
that's
Amy?
GPPA and things like that.
So with the way our curriculum is designed, we cannot do it in 1 year. What we can do it in is in 1 year and a semester. So if a student starts this fall, they would take courses for the fall, spring, summer, and then 1 second fall. So basically 1.5 years.
Perfect. And then the last question about like kind of housekeeping issues. And then Jamie, there were a couple questions about RAs, opportunities.
We've already addressed a lot of
that.
those, Sherry. We addressed most of those in the panel.
Can I go back? I'm sorry,
Yeah.
real quick. I just wanted to clarify. The 1.5 year program is really only able to be completed by professional enhancement students. The students are doing a shortened program, the 43 hours, not the 49-hour program or comprehensive program. That would also include our joint degree students.
Okay, and then just about, Jamie, the one thing that I think that wasn't addressed about RATAGA is about if it's all year opportunities. I know primarily we look at these in August and the hiring, and like I think a lot of students sometimes want to hear, if I don't get it in the fall, can I get one in the spring? Can I get one in the summer?
Yeah.
That kind of stuff.
Yep. So the answer to that question is it's all year round. A lot of students don't end up with an RA or a GA position in the fall because they're just getting on campus. They try and find their way, just getting settled, figuring out classes, all that type of stuff. And then once they start to get comfortable, then they'll start applying for positions for the spring. We hire year round. I'm one of the faculty in the department that hires RAs all the time. And so, and it depends on grants that I have coming in and likewise with my colleagues throughout the campus and throughout the school. So I hire students for fall, I hire students in spring, I hire students in summer, I hire students like Mary who's working for me year round. So it just really varies, but there are opportunities year round. It's not just fall. So if you, get to campus in August and want to just take classes the first semester because you're taking the 2 integrated core courses and the policy course, and you really want to get yourself situated class-wise, totally fine. There'll be plenty of opportunities to apply for spring semester or summer.
Well, and I always love when this question comes in, because this question comes in once a year about, can I get in-state tuition for my second year? And I always find that like just such a great question. And I don't know, Amy, if you have a good canned response to that, or.
So I feel like this is something that's constantly changing. So
I know, right?
When I first started at UIC, it was almost impossible for a student to switch to in-state tuition. And I've heard recently it's become much more easy, but that's something that we don't determine. The school doesn't even determine it. I think it's the state.
It is the state.
It's something that we can look into and see what it is as of right now, because it is something that does change.
Yes, that's what I was going to try and answer that as well, but it's like, I know when you started, it was one way. When I started, it was another way. And then it just keeps.
The last time I checked, I believed you could switch in your second semester, but again, that's something that we would need to look into.
Right, and it does also based on employment too, right?
What you're doing, and so yes. We need to look into.
We have about 7 minutes left. It's amazing how time flies when you're having fun, which I really enjoyed this time with you all. Are there other questions? You can either put them in the chat box, or if you want, unmute yourself and ask your question. We are here to answer your questions. Let's see anything coming in. All right, Sherry, do you, you know what, I will just quickly share my screen one more time, and we can just share with you about the 2 flyers that Sherry sent out earlier today. And let me just go from this one, there we go. The first one, and if you didn't receive the flyer, Helen, I see your question, we'll get to that, and Ashna will get to that too. But if you didn't receive the flyers in the email, there are URLs pasted at the top of the chat box, and Sherry can repaste those right now where you can access both of these flyers. The first one is about the program, and the second one is about the certificate and concentration opportunities. So going back to some of the questions that just came in, let me stop sharing my screen. So Amy, when, so there was one question about, I guess for me, when should we start to apply for positions for the fall semester? So Amy, I think they can, when do announcements really start posting about fall semester GA opportunities?
Over the summer, but really there's not a lot that goes on over the summer. I would say probably in August. Occasionally there's some in July, but not frequently are there any in June. But it's always good to start preparing and getting your resume together and beginning to look out. Also for students that want to reach out to faculty, you can start, doing the research to see what the faculty are doing research in, if you're going to go about it that route and send your resume to faculty. My office is always willing to accept resumes because faculty sometimes come to us with positions.
Great.
And just to piggyback on that, I think as soon as you make your decision, the best thing you can do is sign up to SPH Times and Views. So like you can get on people's listservs. There's also various job posting listservs throughout UIC's community, because you don't just have to search within the School of Public Health. There's opportunities at the College of Medicine and, liberal arts science colleges and along, so wherever you feel
for an undergraduate course possibly.
Yeah. Yeah.
So Amy, is there a checklist for registration, and is April 15th the deadline for the reservation seat payment of $150?
Okay, so there are checklists for registration, and all of that information goes out in the welcome packet. That'll be sent out at the end of May or in June, and those are only for applicants who have accepted our offer. And the way that you can accept your offer is going into the student application portal and submitting the ITE as well as the $150 deposit that will be applied to your fall tuition.
Great. And then the last question that we have, Amy, for,
Go ahead.
oh, go ahead.
It's okay, go ahead.
So one of the participants has been admitted into the joint Mba Mph program. Can you talk a little bit about how they manage that program, how they balance their coursework across the two programs?
Sure. So for the Mba Mph program, students do it one of two ways. They either split their time in half and they start with one program and only work on that program and then switch to the other program, or some students have actually decided to do them at the same time, where they may take 2 classes in the MBA and 2 classes in the MPH. So we're open to working out however you want to plan out your program. I think it does allow for you to kind of have your foot in the door in both places if you split it up, but I also understand running back and forth to campus can be difficult too. So we're willing to work with students on that. And if you have any other questions about the program, you can email me. Sherry, are you going to send out information about our email?
Yeah, that's exactly what I was going to say too. And also we have, I can connect you with the advisor in the MBA program that will give you an overview. In fact, I think I even have their course structure. I was just looking for it very quickly. But you're welcome to email me on any of these specific questions, but after this session today, you'll be seeing an email from my address, just basically with the slides from today, the flyers again in handouts that we've been referencing, and just a space for you to like kind of ask any future questions. So yeah.
Well, with that, I think we are at our endpoint. It's 1:29. So on behalf of my colleagues and our student panel, we want to thank you very, very much for joining us today. We hope you found it informative. As Sherry and Amy indicated, please feel free to reach out with any questions. That's what we're here for. And we're all sitting at home right now, so we would welcome the questions that you may have. And most importantly, we hope that you all stay safe and healthy, and hope to see you either in person or online in the fall. So yeah. Thanks, everyone.
Thank you.
Thanks for being here, guys. Really appreciate seeing you.